A major development, Merck announcing this morning that its experimental COVID pill reducing hospitalizations and deaths by half in their clinical trial. The company say it will apply for emergency use authorization for that drug as soon as possible. Dr. Bankole Johnson is the chief medical officer at Adial Pharmaceutical, and he joins us this morning from Charlottesville, Virginia. Dr. Johnson, thanks for being with us. This is a major announcement. It is being described as Tamiflu for COVID. How excited are you that we are talking about treatments and vaccines now?
This is a very exciting time because it tells us that we are able to probably now start to get some control over this virus. As you know, this pandemic has run rampant. It has not only been associated with significant hospitalizations of deaths of its own, but it's brought upon, its own second pandemic with an increase in rise in alcohol use disorder, alcohol dependence, drug taking, and mental health issues. So having, if you like, the double whammy of having a medicine and a vaccine is perfect news.
Dr. Johnson, we reached 700,000 deaths just yesterday. I remember when they were talking about 100,000 and the fears that, oh my God, this was terrible. Two things. Have we become numb to this virus? And also, have we now reached the point where the people that are going to get vaccinated are vaccinated and we need a pill like this to be able to make sure that those who don't live?
I think we do need a pill. It's unfortunate that we've not been able to get the vaccination rates in the United States much above 50%. And I think that the lesson of other countries that have allowed us to get vaccination rates much higher have shown that this has been had a major impact on reduction in deaths and hospitalizations. For example, New Zealand is a perfect example in which they've had a tremendous amount of progress, as has Finland and Israel, in terms of full vaccination. Now, we do understand we have some problems in the United States. The United States is large, it's complex. The states are very different in the way they apply their ability to distribute vaccines and apply them. And therefore, having a medicine in the hospital that is ready to be used is really good, because I'm hoping that it will reduce hospitalizations and deaths markedly.
Dr. Johnson, are we now in a new normal with regards to this pandemic, which is that those who want to get their shots have gotten their shots, those who want to wear a mask are wearing their mask and the others haven't, and it is truly a pandemic of the unvaccinated, but it also appears that the unvaccinated are fine with that. Have we reached this point now?
I think you're very perceptive. This has become a pandemic of the mind. The people who are willing to take the scientific evidence and act on scientific evidence and get their vaccine have probably mostly got their vaccine. And now we're dealing with a group of individuals who may be unhappy or maybe scared or anxious, or perhaps are not comfortable with the information that they have been receiving, or have medical conditions that prevent them from taking the vaccine, who cannot get the vaccine. The problem with this is that unless we get a hold of increasing the vaccination rate in the United States, we run the problem of having new mutations which are probably even more virulent than the Delta mutation. And this is a significant problem indeed for all of us. But I would say that we have reached a crisis of the mind. We have reached a crisis in mental health. We have reached a crisis in alcohol and drug addiction. And this has become a continuing crisis to the point in which, a lot of healthcare givers now just claim to be exhausted.
But let me push back on the numbers. If 42 million Americans have contracted the virus, if 165, 175 million have received their shots, have we reached the point now where even if there is another strain like the Delta variant that literally tore through the United States, won't have enough oxygen to be able to do the damage that we saw just this last summer?
Well, it's a good question, but if the mutation escapes the vaccine, for example, if the mutation is not being able to be suppressed by the current vaccines, then we'll be back at point zero, which means that everyone will become vulnerable all over again, even though we would have a large number of people who have received their vaccine because of the individuals who've not received their vaccine. Now, this is not to attribute blame to a specific group of individuals because their reasons need to be listened to as well. But it does mean that all of the effort that we have exerted so far as a nation and in healthcare will get rolled back.
I don't know that I like the answer to that question. It is not comforting to say the very least. But I want to get this. Pregnant women have been held hostage by this virus because they've been waiting for the information they believe they need because they are protecting two lives, their life and the life of their unborn fetus. A total of 161 pregnant women have died of COVID, 22 deaths in August alone. Talk to me about why the CDC says, pregnant women, please get your shots.
If you're pregnant, you should get your shot. You should consider it this way. You're not only protecting your life, but the life of your unborn child. COVID wreaks havoc in pregnancy because not only is it likely that mother may actually succumb to the illness, but the child is also vulnerable because of the increase in body temperature, the change in physiology, the lack of oxygenation, all of which can cause premature death, premature birth, stillbirths, and birth complications. So it is very important for pregnant women to get their vaccine. And I'll say that in general, pregnant women always seem, in my experience, to always first put their child first. And this is a unique part of nature that women are designed to look after their kids and to look after their unborn children. So my appeal would be, if you're pregnant, please think about your kid that is about to be born, and please have that vaccine to protect the two of you.
Dr. Johnson, I've only got 30 seconds left, but this is important. We're going into flu season. People want to know, one, should I get my flu shot? Two, if I'm going to get the booster shot, should I get my flu shot now or wait until after I get my booster shot? And your thoughts on getting them both?
Very quickly, you should get your flu shot now, and then you can get your booster shot when it's available. And you should get them both. They are not the same disease. They have different effects on the immune system, and you need to get both shots.
That was probably the best advice I've heard in 30 seconds on this program in quite some time. Dr. Bankole Johnson, he is the Chief Medical Officer at a Dial Pharmacy. Dr. Johnson, thanks for being with us as always.